It's not always easy to get your health insurance to pay for the services you need, particularly when it comes to mental health coverage. Hi, my name is Robin, and I'm a Family Support Specialist at PPAL. I'm here today to share with you 5 tips on talking with your insurance company about mental health coverage. Here's tip number 1. Know that you have a legal right to mental health care. Coverage of services for mental health, behavioral health, and substance use disorders legally must be comparable to physical health coverage offered by insurance companies. For example, insurance companies can't charge a higher copay for mental health visits than they do for medical visits, or put a yearly limit on the number of covered mental health visits when they don't place such a limit on visits for physical health. In other words, in Massachusetts, your insurance company is most likely legally required to provide good mental health care for you and your child. Here's tip number 2. Be thoughtful about how you work with your insurance company. First off, always insist upon what you need for your family. Don't take no for an answer the first time around. Sometimes insurance companies make exceptions regarding coverage, and the squeaky wheel is the one that gets the oil. Next, always ask for names, numbers, or IDs for everyone you speak with from your insurance company, and keep a record of each contact, including the time and date of each call or email, and a summary of what was discussed. This can be very helpful if you need to appeal a decision later on. Finally, ask your health insurance company for a case manager or social worker. This is a benefit that most health insurance companies offer, but few talk about. This benefit gives you someone on the inside working specifically to get your child the care they need, so it can be very helpful, particularly when coverage is difficult. Tip number 3 is if your child doesn't already have Mass Health as health insurance, consider getting it as secondary insurance. If your insurance doesn't pay for a service, Mass Health might. Mass Health is a combination of Medicaid and the Children's Health Insurance Program, or CHIP, and all kids with disabilities, including mental health challenges, living in Massachusetts, are eligible for Mass Health as secondary insurance. When you apply, you may initially be rejected by Mass Health based on income alone, but once they process the disability supplement form that you will submit, you should qualify. Unless your income meets certain requirements, Mass Health secondary insurance will come at a cost. However, something called premium assistance can lower that cost, and Mass Health can help with deductibles and copays, lowering your overall healthcare expenses. In other words, it may or may not make financial sense for your family, but it's definitely worth looking into. My 4th tip is in regards to finding a provider. If you can't find a provider with availability, it's worth it to ask your insurance company for help. Be sure to keep notes on the calls you've made, including which agencies you've called, who you talked to, and the expected wait time at their organization. It's important to keep a record of your attempts to secure a provider, especially if you need to request permission to use an out-of-network provider. Let's talk more about that. If you find a provider with availability, but they don't accept your insurance, it's possible that your insurance company will pay for them anyway, under what's called a single case agreement. Under a single case agreement, the insurance company agrees to cover services from your out-of-network provider, and that provider agrees to accept the insurer's in-network rate for those services. Finally, if your child is stuck boarding in the emergency department, or if you're having trouble accessing acute care, always talk to your insurance company, even if the hospital or other provider says they already have. The people that you'll talk to as a member of the insurance are different from those your provider spoke with, and the people you speak with may be able to find options that the provider side missed. It's worth checking out. My last tip for you, tip number 5, is simply a great resource to look into when you're working with your health insurance for mental health coverage. It's called the Insurance Resource Center for Autism and Behavioral Health at the University of Massachusetts Medical School, and can be found at massairc.org, massairc.org. This resource provides information, resources, help on issues related to medical insurance for autism as well as behavioral health needs. They are wonderful and can help you with the entire Mass Health application process if that's what you are pursuing, or can help get your current insurance company to pay for what you need. Those are all my tips for today. I hope some of them prove helpful. Feel free to reach out to PAL anytime for help with mental health insurance coverage or anything else. And you can find more information about talking to your insurance company on our tip sheet, which can be found at our website, ppal.net. Thanks so much, and have a good afternoon.